Let's look at the study which demonstrates role of beta blockers in acute coronary syndrome. The study aimed to assess and compare the in-hospital and 1-year prognostic impact of beta blocker prescription after acute coronary syndrome in patients with previous or de novo atrial fibrillation and in patients with sinus rhythm. It has been already known that beta blockers are recommended in patients with previous acute myocardial infarction, aiming to reduce morbidity and mortality. Their benefit is greater in patients with associated left ventricular dysfunction. However, in patients with atrial fibrillation, its prognostic benefit is controversial. The study was conducted as a multicentre retrospective trial conducted among 35,279 patients hospitalized for acute coronary syndrome. The patients were divided into two groups according to the prescription or of beta blocker or not of beta blocker. The impact of beta blocker prescription on in-hospital and 1-year mortality rates in patients with atrial fibrillation versus sinus rhythm was compared. Out of 35,279 patients, 14,906 patients were selected. Around 82.5% of patients had a beta blocker prescription and 17.5% patients were without a beta blocker prescription. Patients without beta blocker prescription were older and had more comorbidities, namely valvular disease and chronic pulmonary obstructive disease. The mean left ventricular ejection fraction was 53 plus or minus 13% in patients without BB prescription and 52 plus or minus 11% in the group with BB prescription. In hospital and after discharge, beta blocker prescription was less frequent in atrial fibrillation patients. Beta blocker prescription was associated with a lower in-hospital mortality rate regardless of the rhythm, with an 81% risk reduction in sinus rhythm and 79% risk reduction in atrial fibrillation patients. To conclude, beta blocker prescription was associated with reduced in-hospital and 1-year mortality rates. The prognostic benefit of BB therapy was equivalent in acute coronary syndrome patients in sinus rhythm and with previous or new onset atrial fibrillation.